Good afternoon. This is Dr. Alex Ehsan. I'm a hematologist, oncologist for a couple of decades now. And I'd like to tell you a story about one of my patients. Sarah was 56 years old, healthy, ate well. She actually exercised. And she told me that one morning when she had gone for her daily workout, she noticed a small lump above her collarbone, and it actually didn't hurt, and she was under the impression that it's nothing and it'll disappear, like we all would have. And somehow weeks went by and she ignored it. One of her colleagues told her that breast cancer can show up like that, and so that frightened her. So she got a mammogram, and the mammogram came back normal. The lump in the neck continued to grow, and despite all of this, she felt pretty healthy. She finally decided to talk to her primary care physician, and an ultrasound and a CT scan were ordered. She ended up having a biopsy of the uh, lump that hadn't been seen on the mammogram or the armpit, and it ended up being called follicular lymphoma. Uh, I remember Sarah basically, with the pathology report in her hand, looked at me and said, "So, Dr. Ehsan, do I have cancer?" And I told her yes. And I explained to her that unlike many other cancers, follicular lymphoma usually grow very slowly. In fact, many people uh, can have follicular lymphoma for years before it's discovered. So exactly what is follicular lymphoma? And that's why I made this video. Follicular lymphoma is a cancer of our B lymphocytes. The B lymphocytes are practically the white blood cells that normally protect us against infections. And in the case of follicular lymphoma, instead of a B lymphocyte growing normally like a lymphocyte should, uh, these abnormal lymphocytes accumulate in the spleen, bone marrow, and other organs, as well as the lymphatic system. And follicular lymphoma ends up over time growing, even though it's a slow growth. It is a form of non-Hodgkin's lymphoma, and many patients have really no symptoms. The enlargement of the lymph node sometimes is associated with fevers or feeling of fullness in the abdomen if the spleen is enlarged. Night sweats and weight loss, even though happens over time, is not common. And generally speaking, many patients tell me that they completely felt normal. And it is completely normal to have a follicular lymphoma for a while without knowing it. And the diagnosis really begins after a PET scan or a CT scan is done and a biopsy is done. And the pathologist sees those cells, and quite often they run a special test called immunohistochemistry uh, using their microscopes, and ultimately a bone marrow biopsy to determine follicular lymphoma. I always tell my patients, even for stage 4 follicular lymphoma, which basically means lymph nodes above and below the belly button in both places, meaning one in the neck, one in the groin, that would make you have stage 4 follicular lymphoma. That doesn't necessarily mean that it's a poor prognosis. Unlike many cancers, stage of a lymphoma simply tells us where the lymphoma has traveled, because often follicular lymphoma is found in the bone marrow, yet most of my patients that I've diagnosed in the past 25 years have lived for decades. Now, the hardest conversation is the best treatment sometimes is no treatment. And that sounds so strange. Uh, I always have patients in the clinic that I talk to on daily basis, and I tell them, yes, you have follicular lymphoma, and I'm going to see you in 3 months. And patients kind of look at you and they say, wait a minute, how can you tell me I have lymphoma and you're not going to treat me? So the term of active surveillance or watchful waiting is something that I've had to repeat often, because if the lymphoma is not causing any problems, starting treatment immediately has not been shown to help people live longer. Instead, we rather monitor patients with exams, blood tests, imaging studies, and if treatment becomes necessary, we have amazing biological drugs such as Rituximab, Immunotherapy. Sometimes we combine that with bendamustine, or if we can do a targeted therapy depending on the genetic testing, we always do that. There are more recently sophisticated treatments like CAR T cells, bispecific therapies available for lymphoma, and the research really is amazing, to a point that I really have to read at least once a week to not only stay board certified, but to know what I'm talking about. Most patients respond beautifully to treatment. The lymphoma often shrink dramatically. I usually give them allopurinol so they don't get gout, because it just goes away very quickly. And quite often they go into these long periods of remission. However, years later it does come back, and then we have more additional treatment that ends up being very successful. So if you've recently been diagnosed with follicular lymphoma, remember, not all lymphomas are the same. Follicular lymphomas are very treatable. They grow very slowly, and they don't necessarily need chemotherapy, the type that everyone hates, the ones that make you bald and nauseous and miserable. And I always tell my patients, first, find out what you have, in this case, non-Hodgkin's lymphoma. Second, make sure you understand that non-Hodgkin's lymphoma basically uh, covers follicular lymphoma, and follicular lymphoma being the most common, slow-growing non-Hodgkin's lymphoma, despite it sounding awful and frightening, most patients live long, healthy, and happy lives. If you're my patient, and I have plenty of patients with follicular lymphoma, look forward to seeing you with your next blood work and PET scan. And if you are not my patient, this is simply to educate you, and hopefully you'll never end up having to see me as a patient. Best of luck to you, and I hope this helped some of the folks that are battling with follicular lymphoma.